No, type 2 diabetes, I'll plug someone else's book, but there's this nephrologist, Jason Fung. He wrote a lot of stuff about type 2 diabetes. And type 2 diabetes is a lifestyle condition. So, you're not born with it. It can be cured, and it can be cured through, diet, exercise, and absolutely medications. They're absolutely warranted in type 2 diabetics. But really what it comes down to is that if you work with somebody and you help to prevent them from using more and more medications, then you'll prevent the progression of the disease.
You have a success story of how you've gotten diabetics off of insulin. Is that correct?
Yeah. So I had a really cool one. So I had one patient that came to see me. He was actually, you would like this as a pharmacist. He was on U500, so he was on so much insulin.
Whoa, he had to go
Yeah, we don't use U500. So for your viewers out there, U500 is concentrated insulin. So it's basically 5 times the regular insulin. It's that concentrated. And we basically walked him down, because you can't take somebody that's on that much insulin and just tell them, hey, don't ever eat another carb and quit eating, quit taking, start intermittent fasting and quit taking your insulin. And it's tough. In the end, we have him basically down to about 35 units of insulin a day. And we're slowly walking that down even more. He's lost a substantial amount of weight. He actually called me one day and he said, my blood sugars are back up. I don't feel well. I'm having to take more of my insulin. We did get him off U500. We just have him on regular insulin now. And he's like, plus, I think I have a hernia. I can't see you tonight, but tomorrow night I'm booked, but I'll just come at the end of the day. I'm done at 6:30. Just swing by. I'll take a quick look at it. He's like, perfect. So he comes in, he walks in at 6:30. He's like kind of limping. When I first looked at him, I thought, this guy doesn't have a hernia. So I brought him back to the office and I examined him and I said, oh my God, you have a huge abscess. I said, I think the most effective way to manage this is for you to go to the ER and get a CAT scan and get some blood work and just see where we're at. So he went to the ER and actually called up the ER ahead of time, and I told them everything, and they were, very happy and appreciative, because, most family docs don't have time to do that because they're stuck in this system that doesn't allow that. The next day, he had a heart attack. Had nothing to do with what happened or what I took him to the hospital for. Actually, he had a heart attack 2 days later while he was in the hospital. Since he was in the hospital when he had that heart attack, he was, coded and immediately transferred to the internal care, intensive care unit, and intubated and put on pressors. So he was intubated in the ICU, put on pressors. And the only reason, he came in, it was interesting. He came to see me when he got out of the hospital, and I read everything. And I said, oh my God, what happened? He said, you saved my life. And I said, well, I don't think I saved your life. There was some divine intervention there. But, we kind of had this, when we talked before, is that, I don't know if I saved his life, but I feel like direct primary care might have saved his life, because I think in the traditional model, I don't know. I think I would have, if he would have called me and I would have talked to him, which in my old model, I talked to patients on the phone too. It wasn't unheard of because I was in private practice. I think I would have put him on my schedule, but it would have been 5 days later. It would have been a week later. I'd have been like,
So people can understand how serious diabetes is.
Right.
Diabetes puts you at risk for cardiovascular disease, correct?
Yeah, absolutely. I mean, and unfortunately, the presenting symptom for most men that have a heart attack is death. They have a heart attack and they die.
Well, and I think one thing, when you talk about value of your practice, I know direct primary care, I don't know what your fees are. You can get into that a little bit later, but it's really, really very affordable. And, it's about the same price as a gym membership usually. Now, when you throw a personal trainer in there, it gets a little bit more expensive. But when you look at just the cost of medications alone that she got off these medications, even if the insurance was covering them, she was probably paying, anywhere from $5 to $10 to $20 copay or plus a month. And then when you look at the opportunity cost, that's priceless.
Absolutely.
That part is priceless. So even if the fee is $300 a month, it's like, if you don't do something now, you will end up spending a lot more than $300 a month.
Well, yeah, it's like that quote: you can either pay the farmer now or the cardiologist later.
I love that. I'm going to steal that one. Is that okay?
I stole it. You can steal it.